Welcome, friends, and thank you for tuning into the Optimal Health program today. I hope you're all doing well. A lot of great information to talk about today. I was on the computer looking at all sorts of cool things. And as you know, we'll talk about articles and research and different topics and little tidbits, or I call them nutritional or clinical pearls, to be able to discuss to give you the edge, to keep your body healthy and strong. We'll talk about how to lose that 15 pounds that you want to get rid of for this summer. We'll talk about diet and exercise and how to set that up. It's not hard to do. How to repair your hair and things that are beneficial for your hair growth and repair. And over time, as you get older, for men and women, what you need to look at. We'll talk about exercise. We'll talk about sexual drive and function, because there are certain parameters that you need to look at to understand that. And some of these things we're going to use as little tidbits to put on social media. So there'll be a 30-second to 1 minute blurb about something, which will guide you towards the YouTube channel, guide you towards the website, landing page. There's so much going on. It's well above my pay grade to understand all of this stuff.
That's what we're here for, Doc.
Yeah, so fortunately, Frankie does a wonderful job here with the electrical mechanism of the podcast and all of that. And got a good friend in Florida who's working on coding for both the RPM module that we've created, so that people that are Medicare age and have Medicare insurance, who have hypertension, diabetes, arrhythmias, and 20 different diagnoses, including COPD and degenerative disorders, we can track them at home with blood pressure cuffs, glucometers, a watch, a ring now, which is coming out, and a bracelet, which will be coming out soon. So we can track your vitals and make sure you're staying within the right range and not losing control. A scale helps us, understand what your weight is. And look, if a patient goes to a doctor 3 or 4 times a year, that's only 3 or 4 readings for sugar, pressure, whatever. If we have this ability that every time you check your pressure, it goes right to your page in our computer, we track that. So if your pressure's too high, too low, sugar's too high, too low, we are notified. We contact you and just fix things. So it's a genius idea, the remote patient monitoring mechanism, to be able to keep everything in a perfect zone for you. And a lot of what we do is the telehealth mechanism, which is also super important. So a lot of wonderful things going on, and we'll try to explain them as they happen. So if you'd like to call in, and not that many people do call, 888-420-9272. If you'd like to chat, we'd like to hear people's voices, especially if they come from areas where they have a nice accent.
Yes.
There are certain parts of the country where the accent's not that great. I'm not going to mention. But
then we got South Carolina with the beautiful...
There are southern accents that are terrific and Midwestern accents that are terrific. So if you'd like to call in, we certainly would love to hear from you. And, of course, all our friends at all the different platforms that we're on, from Spotify and et cetera, YouTube, Rumble, and our big program on Saturday Rumble show. We're hitting 200 and some odd thousand views now, right?
Oh, yeah.
So that's pretty amazing to me. Fortunately, the people at Rumble like it and like what we're talking about, so they're going to give us some promos so that people that watch during the week could also watch and ask questions on a Saturday. So
covering all the bases for you.
You have to be thorough. And I love doing this. I love getting information, digesting it, no pun intended, and then giving it out to people so they can understand what they can do to become healthy and keep their body functioning as a younger age person. There's an old saying, you want to die young at a very old age. So the healthier we become and the healthier we are going forward, the better our lives will be in every way. Okay, any calls or comments or questions yet?
Got a couple amens. Said, how about Tennessee? We got some accents.
Tennessee. Memphis is in Tennessee, home of Graceland. And I just spoke with my buddy Ray. We're going to go, I guess, on the first day that the epic Elvis movie opens. So I told him I'm going to call him later. We're going to go online and get a couple of seats and see who else wants to join us. But he's a big Elvis fan. I'm a big Elvis fan. And I like the idea of seeing all the behind-the-scenes, video of people he's talking to and, getting ready for the concerts. Cool stuff. Historic but cool stuff.
Yeah. It's crazy how good they make old footage look now, too, with the ways that they enhance it.
It's just, you're taking things that are from the 60s and 70s, and the clarity of the video now, because they can fix it. I don't know exactly how it's done, but it's amazing. It's spectacular. So it's interesting, and even with AI now, because you're looking at something and saying, wow. And there was an AI thing of President Kennedy, of JFK. I'm like, wow, that's probably what he looked like, when he was, young and healthy and, was a great orator and he could discuss things, et cetera, et cetera. It's like, wow. You kind of miss things in our generation because these things happened many years ago in the early 60s. And you wonder what it was like and, what he looked like when he was, giving lectures and making talk and conversation. It's pretty cool.
So, incredible. And, you got to be careful because you can't tell what's real anymore.
You have to look very closely. If it looks too good, it's not real.
Yeah.
If there's some blemishes or some imperfections in the look of a person, et cetera, it could more likely be real. But it's incredible what it's doing. We're also setting up a mechanism for people that can be anywhere in the country. And if they want to have their blood work reviewed through AI, and we're making this, they can get on a platform. It's not ready yet, but get on a platform, put their blood work in, get a complete AI review. If you want to have a doctor telehealth visit, review, make recommendations, recheck your blood, we can have that done. If people want to have vitamin or diet or exercise recommendations through the AI module, that will be done. For people who want to be on hormones, on peptides, etc., then we have to do that, through the medical realm. But it's a pretty cool idea to do what I'm doing in the office for people that could never really get to the office. And because my approach is so different and the blood test is so thorough, we're going to make that available too. So if a person had blood work done from a doctor and they didn't test vitamins or they didn't test hormones or they didn't test heavy metals, as you pop that into the platform, we'll be able to see that and suggest that we can get you a prescription to get these better tests done so you really understand what's going on. And what we're doing, really, if you look at individually, the tests in number, about 220 different tests. No doctor does that. Some companies online say, we're doing 100 tests, 75 tests. Not enough. The more you learn about your body, the healthier you become. So relatively soon, we'll be talking about this and putting the information everywhere so people could take advantage of it. But the ability for AI to do and understand and gather is it's staggering. So this is a perfect way for us to use it to help people. Now, granted, the AI has to be told what are the best vitamin ranges to be in, because if a lab says vitamin D is supposed to be between 30 and 100, if you're at 40, the lab and a doctor might say, yeah, you're okay. This damn shirt keeps falling down.
I was waiting for it,
Doc. It's driving me crazy. It's a brand new custom shirt, but for some reason it's sort of like sliding down. In case you thought this was AI or you thought this was a fake show or not a real show, my collar is playing with me. So I have to give the parameters to AI to say that we want vitamin D to be in the range of about 80, close to 100. So if we're making recommendations and we recheck the blood and the vitamin D levels are at 80, close to 100, great, that's perfect.
At least it's
Forgot
beautiful.
to turn the phone off.
At least it's beautiful.
Yeah, it's Claire de Lune. Right in the middle of the podcast, I got to call you back. I guess some of my friends are not aware that Friday at 12:30 is our live venue. So, so with putting in the best levels for your vitamins, best levels for your hormones, best levels for exercise, then the AI has the perfect discussion to create. So that's where we are. Any questions? Otherwise, we'll go to some cool topics.
Just a couple comments. Sorry, someone mentioned there was a little bit of an echo, and I didn't realize I had some speakers on in the studio. I apologize. But someone just mentioned that it's great that you're able to teach the AI instead of assuming that it's always right.
Well, like anything else, there are limits to a mechanism. And, when AI first came out and lawyers were using it and doctors and architects and a lot of friends were using it, they always had to double check it to make sure that it was, right in that perfect realm. The first time I used it, I had a PA student who was rotating through the office, and I asked her about ChatGPT, and she said, sorry, people, ask it a question and tell them what you want, and it'll create it. So I said, give me a 2-minute discussion on vitamin D and how vitamin D deficiency correlates with different cancers with medical, study research documentation. Click, done. So I looked at it, I said, wow. And it was good. It was spot on. It said vitamin D, the sunshine vitamin, blah, 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 blah. Research shows that vitamin D deficiency increased the risk of breast cancer. And it was done at Johns Hopkins, another study, and it was just wow. And initially, I just couldn't grasp how it was able to do that. But think of it. Every time anybody's ever gone on Google or search engines to look at information, and information is created, that's stored. So there's this massive, I don't want to say knowledge base, but massive base of information that is available at your fingertips. It's just allowing the computer to put that right into the answer. So I think it becomes a great idea so that we can really give people the best information, real-time information about your body, what your body needs, make recommendation, correct it, and there you have a perfect outcome.
Mm-hmm. We got a comment here. I was trying to call in. Well, I'll tell you, my computers have not rung yet. I promise you that. So we didn't get your call. They said, what value do you look at to determine toxic liver or kidney?
Well, we're looking at, liver enzymes, the SGPT, ALT, AST. That tells us if there's inflammation in your liver. Secondarily, we have to look for things that may be creating that. So we look for heavy metals through blood and urine. So these are things that are relatively easy to check. Although there are people that are exposed to different substances, there aren't many labs that might test for carbon tetrachloride, which is very damaging for your liver, or pesticides and some of the things that people may spray around their house to kill, termites and such. So as much as we'd like to have that availability, we're somewhat limited. We may know if the liver enzymes are elevated, then to start to pursue that, or if the kidney function's declining, to pursue that, look at heavy metals, look at nutrients, a combination of the different things. We use phosphatidylcholine with glutathione to help to bind to pesticides, chemicals, toxins, metals. There's research on that. We use chelation with calcium EDTA to bind metals and pull them out of the body into the urine and then capture them and see how much is coming out. Then over time, as you do 10 treatments, you repeat the urine after the 10th IV and see how much is not coming out. And you know that you're pulling those things out of your system. So although we would like to have the ability to look at a wide range of different chemicals, bisphenol A, Nalgene, we'd like to be able to understand what microplastics may be within your system. We're looking at that. We're working on companies that may be able to tell us what's there, and then as well, a protocol to be able to get these things out of your system. So we're on it. It's just takes some time.
All right. Up to date on that.
Let's start with a little clinical pearl.
Ooh.
Now, this time of year, everybody's jumping all over the gym. Gyms are crowded because everybody wants the summer to be a wonderful summer with some nice, lean, tan, healthy people running around. How to lose that 15 pounds for the summer is sort of the topic that we can talk about for a moment. It's very straightforward, very simple. Once you look at your body and you understand that you probably have been eating a little too much or too much carb, you haven't been doing the exercise, over time you're getting a little older, your hormones might be low, your vitamins might be low. Perfect mechanism is to test your blood for vitamins, minerals, and hormones. We typically will discuss with that person right off the bat, even the same day we're doing the blood test. It's not back yet. It takes 5 days to come back. Where we'll tell them to cut the carbs down to 30 grams a day, which means no bread, no rice, no pasta, no oatmeal, no grains, because they have a lot of carb and sugar in them, and that makes it hard to burn through that to get to the fat to burn it, number one. Number two, you have to exercise for at least a half hour to 45 minutes, nonstop. You can't walk down the block, stop at the corner, wait for the light to change. You want to constantly move for that half hour to 45 minutes. And if you can get somebody to go with you and start a conversation, that exercise can last an hour. If you look at your blood test and your thyroid's low, DHEA, testosterone's low, you have to correct that because that enables better fat burning, especially with exercise. So it's a combination of things that creates that result. So low carb, exercise, correct your vitamins, minerals, and hormones. And you'll be able to see within yourself that, wow, the bloating's gone away. And I think I'm losing inches because my clothes are fitting looser. And if you want to get on the scale here and there, you can watch to see that your weight's coming down. Now, if you're doing a good amount of exercise, weight training, you'll put some muscle mass on, which is great. So if you're going to lose 25 pounds and you put on 5 pounds of muscle, it looks like you lost 20 pounds. But you're still in a better place. So we want to gauge that and track that. So that's, of course, how we do that. For a lot of people, their doctor won't do the blood test for vitamins and minerals and hormones. So we make that available through either telehealth, where you can call the office, set up the telehealth appointment. We send you a prescription, get your blood done, review the blood work within the week, and then guide you as to what to do exactly. And then at the end of a month or so, as you're getting your results, your weight's coming down, we may recheck to see if the abnormal blood tests are now corrected. That's the thorough way to do it, whether it's high cholesterol initially and now the cholesterol's down, or vitamin D is low and now vitamin D is great. So that's the best way to create that mechanism. And granted, there are a lot of people out there who don't really have that many medical problems, but can do the low carb, can do the exercise, and that'll be a great start to bringing your weight down. But it's important. Let's talk about another clinical pearl for repair your hair. Now, your hair relies on lots of things, protein intake, your hormones. Similar circumstance, for people as they get older that have a decline in their thyroid, that may make your hair thin. Same thing with DHEA decline. IGF-1, the active component of growth hormone, directly helps to repair your hair and make your hair grow faster, thicker. Same with your nails. It's very good for your skin. So if over time, your hormone decline is affecting your hair, you want to capture that, correct your hormones, and your hair will do better. Of course, you want to have a variety of nutrients on board. I think collagen peptides are important. You can take a scoop of that, mix it in any drink you want. Some people put a scoop of that in their coffee first thing in the morning. Other people, we might, for men, if their testosterone levels are converting to dihydrotestosterone, you want to block that because the dihydrotestosterone could affect your hair, could affect your prostate. Some people use a variety of different shampoos. Some of them like the green tea shampoos that make your scalp tingle. I think that's always nice. Just don't get that on your eye. Pura d'Or makes a great shampoo for thinning hair. And there are a variety of different products out there. Some people like Nizoral shampoo because it has antifungal effect, and that may help to kill fungal organisms that may be on your scalp affecting your hair. So you want to be able to correct vitamins, minerals, hormones, exercise, also get a lot of blood flow there. There's a cap you wear in your head, a baseball cap, and it's got the infrared light. It's called Capillus, Capillus. And there's evidence that that light hitting your scalp can enhance and stimulate your hair. Other people might use Rogaine, minoxidil, foam, because you get out of the shower, you put that foam in your hair, and you let it hit your scalp, it dilates your blood vessels. That can help. So there are a variety of different things that you can do. And some people will do all of them. Depends upon the stage of hair dysfunction and loss you have. But those are sort of the complete mechanism of how to help your hair.
Yeah, we got one person that just said, I've probably tried 20 different shampoos. I give up. I think it's all a scam.
It's not about shampoo. Shampoo is not changing all the other problems that might be there. So one shampoo, if it may be cleansing your scalp, is not necessarily going to make a difference. And there are some people who use either a pump spray of something called Happy Head, which has minoxidil, finasteride in it, a combination of things that could help dilate the blood vessels in your scalp too. So it depends upon what's causing your problem. If it's a man and your dihydrotestosterone's high, shampoo's not going to do it. You need to block the dihydrotestosterone. If it's a woman and her thyroid's low, or DHEA is low, or IGF-1, the active component of growth hormone, is low, you need to correct that. If you look at a younger person, their hair typically is great because all those things are there. The hormones are great. The vitamins are typically good. They're doing exercise. All of these good things are on board. But when they start to drop, that's when the hair loss, starts to become much more significant. But you have to reverse that mechanism. You have to fix and fine-tune and get a correction of the causes of your problem.
Someone in the chat said, I would like to get my weight down. I will do it for you, my friend.
Awesome.
I'll take it.
Love to hear that. I love to hear and see people that are enthusiastic. And there's an old saying, you give a man a fish, he eats for a day, and you teach him how to fish, they can eat for a lifetime. So if we can give you information about how your body's working and what you need to fine-tune it, and you do that, you're there. And then that doesn't go away. You're keeping your body as healthy as you can, as long as you can, because of what we've learned. So that's the basis of the whole, blood test and this whole mechanism.
This is an old comment, but someone said, so that's the creatinine for kidney? I don't know what we were talking about at the time.
Creatinine is a marker for kidney function. If that goes up, it means your kidneys are struggling a little bit. We also look at GFR, glomerular filtration rate, which tells us how well your kidneys are filtering. And if the GFR drops, that would be bad. Because as you get older and your kidneys are losing the new cell production like every other organ would, if your kidney function keeps going down and becomes dangerously low, then doctors recommend dialysis because you have to get rid of waste products of metabolism from your body. Also, in a perfect world, if we could change the loss of cells in your tissues and put new cells in, which can only be done with stem cell therapy from your body, which has no risk, and we've done thousands of them with great result, then you'll have new kidney, new heart, new lung, new liver, etc. tissues, as well with brain, even eyes we've seen repair there. And those new cells will allow that organ to work well again. Damn shirt.
Speaking of stem cells, do you want to give a little teaser of our episode tomorrow?
Yeah, so our super duper big show on Rumble tomorrow, LFA, I just spoke with two gentlemen who are veterans that were wounded, similar to Josh, who's one of our favorite patients for many reasons. He's a sweetheart. And we're going to interview Garrett and I think William tomorrow, and they're going to talk about their benefits from stem cell. Really, really terrific guys. And as I say, we owe these guys a debt of huge gratitude for what they've done in helping to protect the country. And, these guys put their life on the line, literally, and end up injured in many, many cases, and helping to repair brain function, focus, concentration, energy, get your body working right again. It could be a life changer. And you'll hear from these two gentlemen tomorrow as to how great their results have been. So that'll be a great show. Yeah, we want you to watch that for sure. That'll be on 2:30.
Really big show.
The really big super duper show. So for those who haven't heard, stem cells are your own cells. They come from the crest of your ileum, which if I could turn this stupid thing around, your ileum is the big bone that your hip fits into in a socket. So the crest of the ileum drops down towards the middle, and over here is a big fat bump. We extract after we numb and sterilize, and you're extracting bone marrow. The bone marrow is the only preferred way to do stem cell therapy, and that's
Something tells me the yellow's never coming back.
That's unless I start you to do something else with it, a little bit more
It was ironed in a way.
effectively. So let's see if I button it, if it helps. So
Amish Dr.
stem from your body are cells that obviously are yours, and they're there, they're live, they're active. We extract them and spin them to separate red blood cells, plasma, and stem. Take out the stem, inject the joint, put them intravenously, intravenous or nebulizer for bad lungs, intravenous or nasal droplet. So it goes into your brain for MS, Parkinson's, Alzheimer's, stroke, macular degeneration, diabetic retinopathy. So your own cells have ultimate capacity to go where the damage is and create repair. You don't want to go to Mexico, Panama, Costa Rica and get some foreign stem cell from another person where you know nothing about them, their history. You don't know about their genetics, the infection history, how old is the cord, how many cells you're getting. And remember, when you get outside cells from somewhere else, they have to be radiated. There's gamma radiation that's used to kill what might be coming along with those cells. What do you think that does to your cells? And how can frozen cells that may be there radiated for 4 or 5 or more years be viable and worthwhile to you? So we don't recommend that. And of course, the government and the FDA does not allow that. That's why you can't get them done in this country. There have been doctors over time who didn't know that, who started doing it. And there may be some doing that now, but they will end up with a massive problem with the FDA because they do not allow umbilical, amniotic, or God forbid, aborted fetal tissue. And people have commented on, well, I'm 60, 70, 80 years old. My cells are old. No, they're not. Your stem cells are not created when you're born and live and sit there for 60, 70, 80 years. They're made and they divide all the time. So if we take out 60 cc's of fluid and you have millions and hundreds of millions or billions of stem cells in there, that amount is back to normal within a week or so. So that's how quick these cells can divide. Also evidenced by the fact, if you look at the videos on my website where most of my patients are in their 60s and older age for all of these age-related disorders, no one really has liver, kidney, heart failure, etc. in their 30s or 40s. But if you look at these individuals with great results, you could see them tell their story. Then how is it possible that if these are 60 or 70 or 80-year-old people, that their cells are old and are not going to work? That's just a lie. That's just marketing that the companies use to try to get you to spend an inordinate amount of money on umbilical cord or amniotic fluid. In Mexico, Panama, Costa Rica, people can look this up. The cost is insane for umbilical. They're anywhere between $30,000 to $60,000. We had a patient come in who had MS, and we treated her successfully. And she went down to Mexico to see what it was all about. And they were quoting her $60,000. I said, that's crazy. Why would they quote that? And she said, well, they want to give me chemo first. Why would you want to give chemo to a brain that already has damage neurologically from MS? Makes no sense. So that's the little gist of that, the little tidbit there.
Chemo for what?
So for cancers, doctors use chemo. And for a lot of cancers, doctors will use chemo and then put back in your stem cells to repopulate your immune system and to do its thing. So I would imagine some of the doctors in Mexico think, oh, if they do that for cancer, let's try to do that for MS. But all you're really doing is bombarding damaged tissue with, killing agents. I don't understand why you would do that. So that doesn't make any sense at all.
Chad says, leave it to Mexico.
Yeah. There's no standard there. I think they do all sorts of crazy things, and people are fooled by the nature of what they're saying and doing. And even famous people who write books on health and blah, 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 are touting the Mexican mechanism. I've had a lot of people that have come to me that already went to do that and spent crazy money. I had a gentleman who was the head of a very, very, very big international company. And he lived in a house in Connecticut that was like a 50,000 square foot house. Super wealthy. He went down to get his procedures done in Panama and had no result because it's foreign. You could reject it. And it's radiated. I mean, you just don't want that. Why would people think, oh, let me go for that as opposed to using your own cells? It's common sense.
Yeah, someone in the chat. It's amazing how some people just blindly trust these foreign places.
Well, there's a great show on TV I used to watch, haven't watched in a while, called Botched, where two highly qualified plastic surgeons, Dubrow and Nassif, will fix bad plastic surgeries that people would go to get in Mexico and some of these other countries. I've watched some of those shows, and it really is amazing and fascinating to watch. And there are people that went down to those countries to get their butt bigger. And the doctors down there would put an implant in their butt.
Brazilian butt lift.
Not even a Brazilian butt lift, but they went down to get their butt bigger, and the doctor used a breast implant in their butt. I mean, think of that for a minute. If the breast implant is in your breast, there's not that much pressure put on it.
Right, you're not sitting on it.
If you're sitting and getting up and down and sitting on a breast implant that's in your butt region, that's not going to work.
Oh, my God.
It's either going to move or break or something bad's going to happen or leak. And that's what these doctors would do to help to fix some of this stuff. And there are people that have had 3 or 4 or 5 breast implant surgeries to get bigger and bigger and bigger. And you could see how the tissue is just suffering and the vessels are not happy. The blood vessels are all sticking out and engorged. It's just people do the craziest things. Why would you go somewhere to do something where the doctors don't have the same rigid qualifications and expertise and all of that they have here? You have some of the greatest doctors in the world here and the greatest experience. It doesn't make sense to go with less experience.
Shortly before I started dating my wife, she went on a vacation with her family, and they're on, I forget where they were, but they were, it was a foreign place. Mm-hmm. They're on the beach, and they're looking at this girl that's walking down with her boyfriend or husband. And they're looking, they're like, what are we looking at right now? What am I seeing? And they realized that she had a fake butt, but one of the implants flipped.
Yeah.
So it was like a
that
flat.
Happens. Yep.
Yeah.
Yep.
Not good.
You've seen that. It flips, doesn't stay in place. How could it stay in place when, you're tacking it down in 3 or 4 areas, but you're sitting up and getting down and getting up and sitting on, I don't know. People do some crazy things. There's just no logic or common sense in some of those ideas.
Someone in the comments, we live in a failed society. Hey.
Yeah, we live in a wacky society, a wacky failed society. I've seen things that you could never imagine. But, that's also, I like to talk common sense to people and give them the overview as to why something is a good idea or a bad idea. There's so many different things that come to mind, patients that come in with crazy ideas as to what they want to do. Or, for example, 40 years ago, when I started, people weren't really taking vitamins or doing as much as they're doing today or doing as much exercise. And then the whole fitness revolution started happening and it became really significant. Great, thank God for that. But people were just going out and just taking supplements randomly and taking more than they should and, doing all sorts of things that didn't make sense. I said, rather than wing it and not know what's going on, let's check your blood for your vitamins and see where you are. Some people were way too high, some people were way too low. I've had a couple of patients too that, and I think it's more of a fad than anything else, with their coffee in the morning, they're putting pads of butter in the coffee because having some fat decreases your desire to eat other foods. The problem is you take hot coffee and you put butter in it and you're drinking it, you're putting hot fat into your stomach, which is not going to make your gallbladder happy or your liver happy at all. And I've seen people that had rapid elevation of liver enzymes because they're doing that. They didn't know. Someone said, yeah, no, it's a great thing to do. Not a good thing to do. You want to have your coffee? Have your coffee. You want to put a little protein powder in it? You want to put a little bit of the collagen peptides? That's fine. But don't do things that may be, risking your health otherwise.
So we have someone in the chat that said that couldn't possibly taste good, butter in the coffee. But then we have an alternate comment that said you'd be surprised.
So the human body, it's not as though people hate fat. People eat fatty foods all the time. And some people like the taste of fat. And some people might like to have the butter in the coffee, but it's not a good thing for your liver. So most people are rational. They'd say, butter in the coffee? I don't think that's a good idea. But some people grab onto the idea and run with it. Alkaline water is another thing where people will buy $4,000 machines to try to make your water alkaline, less acid, and more base. Or they'll buy something in a store, oxygenated water, and it's in a bottle. Now, gas is not going to sit there perfectly evenly distributed in the water. If you shake it or you open it, just like seltzer, that oxygen is going to dissipate and leave the liquid. If you have 100 bottles on a pallet somewhere and you're lifting and putting things here and there, you're constantly shaking these things up, so chances are you're not getting much oxygen in the water. But the alkaline water probably is more of a risk than not. And the people who are talking about alkaline and alkalinizing your blood clearly are not physicians, because every physician knows with your kidney function, your respiratory function, and the pH balance of your blood, which is supposed to be about 7.2, you can't make your blood alkaline for a millisecond, much less an hour, a day, or a week. Because if you take in something that's alkaline, your body reabsorbs acid to keep your pH in your blood perfect. Milliseconds. So there's nothing that you could do to make your body alkaline for any extended period of time. Just not possible. People that have respiratory alkalosis, diabetic ketoacidosis, yeah, that mechanism is damaged, but you don't want to do that. There's also some comment about if people have cancer and cancer needs glucose to grow fast, just like all cells need glucose to grow fast. And this is Nobel Prize-winning research back in the 1930s by Otto Warburg. He proved that glucose is the primary fuel for cancer, one of the only fuel for cancer. And when that glucose is broken down to lactic acid, if that lactic acid is pushed outside of the cancer cell into an alkaline environment, that works. It's like opposite ends of a battery, so you can't put a plus to a plus or a magnet, you'll repel. So when you look at putting acid outside of the cancer cell into an alkaline environment, the idea is that you're increasing the risk for vascular endothelial growth factor to get more blood flow to the cancer to feed it more glucose. Went to a great conference years ago, and they outlined that. So that's why ascorbic acid, vitamin C, to some extent alpha-lipoic acid, if the ascorbic acid, vitamin C, is around the cancer cell and you're trying to push the acid out, you can't. And that stays within the cell and can make the cell implode. And the vitamin C IVs, which we have articles here on, we'll talk about anti-cancer effect, antiviral effect. They help to create damage to those cancer cells in just that fashion. So there's enough research on that. Don't fall for the gimmicky things that non-doctor people are recommending that you do, because there's no basis to that. You cannot make your body, your blood, or any tissue alkaline at any existence, any time, because your pH balance is always corrected. If you're taking too much acid, you'll pee out the acid. You create, or you're taking in too much alkaline, you hold on to the acid to keep your pH the same.
Got someone in the chat that's saying, thanks for making me realize that I wasted hundreds, if not thousands of dollars on pH water. I even had a subscription for a place down the street from me.
Sorry about that.
I had the same, pal.
We've got to deal with the truth.
Not good.
And you could probably, and honestly, you could go on ChatGPT and you can go on Google and ask about acid-base balance in your blood. What's the pH of your blood? Can you make your blood alkaline for any amount of time? It's just not possible. But people marketing these things, they don't know that.
Got another comment that said Arnold Schwarzenegger started a revolution. I think that was about the bodybuilding.
Arnold, yeah. So I met him once, which was really cool. I went with a friend of mine who's a ballerina to Lincoln Center years ago because they were honoring Jackie Onassis. And Twyla Tharp, I believe, had created a whole program, and some of it was Frank Sinatra music, and she had the dancers do a wonderful, wonderful job. Intermission, I go to get a glass of champagne, as everybody does. Walk up to the bar, and a woman bumps into me, and it's Maria Shriver. And in my head, I didn't say it out loud, I said, Maria. I said, oh, my God, that's Maria Shriver. Arnold can't be far behind. And then 2 minutes later, Arnold came over. I said, hey, how are you? Shook his hand. I'm like, wow, that's cool. I met Arnold. Another time I was in L.A., and I went with my friend Eric. We worked out at a gym, like a high-end gym in L.A. somewhere. And there was a famous bodybuilder, and she became an actress to a small extent, named Rachel McLeish. She was like the first woman's fitness bodybuilder. Now, she didn't look freaky like some of the people today, but she was in unbelievable shape. And she looked like some of the girls who do the fitness competition. Not all veiny and crazy, but she had great shape. She's there in an outfit, and I had a towel around my neck. I go to throw the towel over the machine, and other towels there when I go back, and I'm working out, and she walks over. I'm like, oh, my God. She was gorgeous. I think she's Native American, but she is gorgeous. If you look up Rachel McLeish on the internet and you see what she looked like, I mean, she looks great still, but you see what she looked like back then. She was just spectacular. So she was the first woman to carry that torch for women. But between her and Arnold, then you had this massive fitness, weight training, cardio revolution, which carried throughout the world. So he deserves a huge amount of credit, and so does she, for making people healthy and strong. It was also interesting that she made a commercial on TV that says she was getting out of a Lamborghini or some sort of car, and there was a slip of her dress, and her leg comes out first, and she gets out of the car, and she's just perfectly in shape. And she says, remember, you have to pump before you primp, which was, the catchphrase of the commercial. And when I had met her there and she was working out, I spoke with her for like a half hour, 45 minutes. I said, I said, you got to pump before you primp. And she laughed. So it was my brush with greatness.
Some of the chat said, how small did your hands feel when you shook Arnold's hand?
Yeah, his hands are like ham hocks or something, just big, big hands. And remember, if you're lifting weights, your hands get bigger and thicker, But, he deserves a lot of credit, And if you look at his whole life, he was a construction worker who had a dream and unbelievable perseverance and unrelenting desire to create and to do, and that's what brought him to be such a champion. And that's super hard to get to that point where you win so many Mr. Olympias. Then he became governor and the whole thing. And he got into the Kennedy family. I mean, he was really a conservative his whole life. But, it's pretty cool.
Just a side question here. Hello, doctor. Will stem cell therapy give relief for someone who has nasal allergy?
So an inflammatory mechanism stem cell works for and works with, although for people that have allergies, we typically will test via blood, then skin, to see what foods they may be reacting to. Skin is more accurate because it leaves the allergen liquid in your skin for a half hour to allow antibodies to bind to it. And tree grasses, weeds, molds, we look at that. We tell people to get a air purifier and a few of them to keep moving them around your house to clean, the air in your home. Steam clean your carpets, rugs, get rid of carpets or rugs if you can. You can steam clean your furniture if it's, fabric. But you're repairing an inflammatory cascade with stem, just like you would for lupus and rheumatoid. So you could utilize stem for that. I don't know the extent of a person's, nasal inflammatory mechanism, but any area you have damage or degeneration or inflammation, stem cells would be an advantage.
All right. Let's see here. All right, I'm up to date here.
Let's see what else we have here that's interesting. A couple of great studies on vitamin C IVs helping to quadruple your killer cells, helping to inhibit hepatitis. This is a great study. Epstein-Barr-induced hepatitis. Then yet another one about pharmacologic evaluation of intravenous vitamin C, how it's safe, and there are no side effects to it. And in studies where they looked up to 100 grams, 100,000 milligrams of vitamin C, safe and effective. IV vitamin C in critically ill patients. A meta-analysis. It's safe and appears to be associated with a trend toward reduction in overall mortality. There was a great study came out a few years ago about sepsis, and people that have blood infection, sepsis, can die relatively easily. And they did vitamin C IVs in a hospital for all the patients that were septic, and they did really well. So we know how good vitamin C is to stop free radicals, to enhance your immune response, and help to inhibit viruses and even cancers. So it's something that's gained a massive amount of following over the years. And 40 years ago, and as soon as computers and the internet and some of the search engines popped up, I started looking at Health Database Plus was one of the first places where you could just go on and, you had a router, boop, 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 boop. Sounded like R2-D2. And, you had to wait for the phone hookup to get your computer set. And I would look at articles on vitamin C, and there were a bunch of them there. Now, if you go to Google Scholar, there are 1,500,000, 600,000 studies on intravenous vitamin C, inhibiting COVID, shingles, herpes virus, Epstein-Barr. So the literature's there. I just tell people to go on Google Scholar and start looking.
Someone wants to know, did you see that the FDA refused to review the Moderna's new flu shot?
So this has been said many times before. Who is the FDA there for? You could answer that question on your own easily. Are they looking out for our best interests? Are they looking out to see if a drug works or not and whether or not a drug is dangerous? I think they're just looking to see if a drug works or not.
You're talking about FDA? Or
Yeah.
Well, now that RFK's in there.
Well, he's a godsend.
Yeah.
So the other issue, too, about, autism, and they keep ramping up the injectables for kids. Now they want to give 70 injections for kids for diseases that just don't exist anymore. And all those doses of mercury and aluminum, it's like, oh, it can't be the vaccines. We have to keep looking for other things that are not even involved in the mechanism. Yet you look at the Amish people that don't get vaccines, they don't have childhood diseases, and there's no autism. I mean, they're shoving it in your face and making you think, oh, you're a conspiracy theorist because you don't fall along the lines or agree with what we want you to agree with. It's horrendous. I don't trust them. I wouldn't trust any of them. And also, a surgeon or any doctor who does a procedure, who recommends something for you, is supposed to give you informed consent. So you know everything about that option, and your choice is clearly, you can make that choice clearly whether you do or don't want to do it. Where's informed consent with those injectables? Never existed. You think a mom or a dad would say, after they heard all the ingredients and any of those things, oh, yeah, let's do that. Let's give multiples. Let's give 10 at a time. It's just wrong. Absolutely wrong.
Yeah, and now I'm looking into it, and this was going to be Moderna's first mRNA flu vaccine, so that's probably why they blocked it.
Yep, wouldn't do it. Messenger RNA should never be in vaccines because it confuses your body. We know that. And we know that those injectables that have been spread all over the world. Funny thing, too, is how long does it take to make, what did they say, 6 billion people were vaccinated with COVID?
Something like that.
Whatever the number is, even if it's 1 billion. How long does it take to make that? Not a week or a month or a year. Years. And how many facilities would you need all over the world to make that so that within 2 years, 1 billion or more people have had an injection?
The math.
How is that possible? People have to think. They have to start thinking critically. You know?
Someone in the chat's saying apparently it was mentioned in the Epstein emails, like COVID or like pandemic response with Bill Gates, apparently.
Yeah, back in 2015, probably earlier, in the Journal of Nature and Science, they were talking about that we shouldn't be messing around with coronaviruses because they easily can infect humans. And honestly, there are a lot of coronaviruses that were already in the population that did nothing, that didn't hurt you a bit. And I remember before the whole phenomenon disaster with COVID, we used to be able to get a nasal swab from the lab that we use, and you take a swab, you put it into its device, a little pocket, container, you press a button, it seals it, you press some liquid, and it preserves it, and it goes to the lab, and the lab can tell you which type of COVID, which type of flu. You couldn't get those during COVID. They were removed from the population, so doctors couldn't do them. But then they allowed a totally different mechanism to come out to test for COVID with PCR, which the inventor of PCR said it couldn't really be accurate for. So
everyone's just shoving sticks in their nose for no reason. That's what you're saying.
It's just
what a time.
It's a manipulation to get people to do what they want to do.
Yeah. Chat's saying arrest Fauci already.
Yeah, I don't see what we're waiting for. There's more than enough information to document all this in lots of countries, too. Another comment I want to make that's super important. You should take control of your health. You should be responsible for your health decisions. You should be responsible for eating right, doing the exercise, taking your vitamin, fixing yourself. It has to come from you because traditional approach will never do that. They're not interested in that. And I think that the pharmaceutical interests and the insurance companies and the doctor and the patient, it's all distorted now. Pharmaceutical companies want you on as many meds as possible. That's their goal because they're trying to, make whatever profit they make, which is in the gazillions. Insurance companies don't want to pay out for a visit, so they're paying less and less, so a doctor has to see you for less time and just write prescriptions, which makes the pharmaceutical interest happy. And the doctor's hands are tied because he can't do the things and the tests he wants to do, which would be good for you. And the patient gets the short end of the stick. So this is typically what's happened. And you could look at this going from years ago to now. What's happening? Meds, 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 vaccine, vaccine. You have to have people open their eyes. But you want to make yourself the best version of yourself. Take control of your health. Put everything into perspective.
It's a pretty good way to end it, I think.
Yeah, I mean.
That's beautiful.
You have to do that. And so many of my patients now, and of course, even, being on the radio for 36 years, et cetera, and I had a huge following of people that, and similarly here, people think the same way. So they want to learn. They want to eat right. They want to exercise. They want to lose the weight. They want to get on the vitamins. They want every part of their body to be better. So it's easier for like-minded people to have this conversation. I rarely ever see a person who doesn't want to do that because if they don't want to do it, they wouldn't come into the office. It does take a little bit of effort, whether we do your visit over the phone or we do it in the office, get your blood done, review that, start the mechanism, walk every day for 15, 20 minutes, increase that to 25 minutes, then 30, 35, 45 minutes, work your way up, and then you recheck and you show that your body's doing better and you document how much better you feel. So everyone has to do this. You can't let or lose your health over time. And a lot of people do that. but you've got to be excited to make yourself healthy. That's why I like giving little pep talks, but you want to be as healthy as you possibly can. If we can help you, certainly we'd love to. You can call the office at 516-794-0404. 516-794-0404. The website's drcalapai.com. Do we have our a QR code for the Stay Strong?
Yes.
This QR code, one of many, we're making others, talks about Stay Strong, a way to evaluate your body, eat right, exercise, correct your vitamins, minerals, hormones. You can contact us there, call the office, email us through the website, whichever way you'd like, and we'd love to help you out. Remember to watch tomorrow, live here at 2:30. We've got a couple of great interviews of veterans whose life has been changed dramatically from stem cell therapy. And of course, we'll take your questions. Thank you. Bye-bye now.